For those who are not familiar with FACE, it's an interfaith organization made up of 51 units, including churches from Catholics, Protestants, Jewish and Buddhist temples, as well as housing associations and union organizations. And we have 51 units altogether, representing over 31,000 people in 2 islands, Maui and Oahu. So I was asked to address how are our members in FACE been impacted negatively by the present healthcare system. Growing up in Kalihi, this is my and our neighbors in Liha, Nuuanu, Palama, and Waipahu's experience of the healthcare system. St. Francis and its doctors and nurses and other healthcare personnel provided care to the members of these communities, which have been largely made up of immigrants from Southeast Asian countries. For over 30 years, St. Francis, a Catholic institution with the mission to provide care to those in need, did exactly that, regardless of their ability to pay, or healthcare insurance, which were predominantly Medicare and Medicaid. Over time, it became more and more difficult to provide care, since Medicare and Medicaid paid only a portion of the cost of healthcare, approximately 79% or less. As a result, the Sisters of St. Francis, because they could no longer abide by their mission, sold the hospitals to a group of physicians who renamed St. Francis to Hawaii Medical Center, who tried valiantly to keep it afloat, but had to file bankruptcy shortly after their purchase. To try to turn itself around, Hawaii Medical Center did the following. They started to limit admissions of dialysis patients covered by Medicare to 5 patients or less. This is serious, as Hawaii has the largest number of dialysis patients in the United States due to the high incidence of diabetes among Native Hawaiians, Filipinos, and Japanese. Moreover, Hawaii Medical Center had the largest inpatient and outpatient dialysis centers in Hawaii. Imagine the cost involved when each session of dialysis is over $600 and Medicare only pays about $300, and that doesn't include other hospitalization costs. Hawaii Medical Center's bankruptcy resulted in nurses and other hospital workers losing their jobs, even those who have worked those for 28 years or more. And it also affected the education of the next generation of healthcare providers. With the closure of nursing units, there were less units for nursing students to do their clinical or apprenticeship in. Hawaii Medical Center could no longer afford to continue their residency program for student doctors and interns, which in turn affected patient care. Very often when a patient is admitted, the one who does most of the initial care are residents and interns, and when they were gone, we did not have that immediate care available. And one day it took 5 hours for a dead person to be pronounced dead because we couldn't find a doctor in-house to do it. Very sad. To me and other Hawaii Medical Center workers, the focus seemed to be on the cost and not patient care. Morale became very low because workers who were once friends were competitors for the same position, virtue of their seniority due to union rules. As a nursing supervisor, it was very difficult for me to turn away patients, but I knew that Hawaii Medical Center was doing it not because they wanted to, but because they had to in order to survive. I remember when I worked during summer, I teach at the University of Hawaii School of Nursing, and during summer I work at Hawaii Medical Center, and one summer, last summer actually, every day for 5 days, a hospital in Kauai called to beg to admit a dialysis patient who hasn't had dialysis for over a week. But we already had our 5 patients, and I had to turn them away. And they said that several people have died as a result of that. That's how bad it is. But Hawaii Medical Center has failed to meet the needs of its community. The case of Hawaii Medical Center is a good example of the unraveling of our present healthcare system. It has negatively impacted Hawaii Medical Center's ability to continue to provide care to the community that it serves. So, FACE experience is, as have been already indicated, cost and access to care. In addition, Like many of us, a lot of the members of FACE struggle with chronic disease management, diabetes, heart disease, cancer, and also affordable or lack of affordable care for our seniors. So what do we hope to see in healthcare reform to address these problems? We need a federal public plan that will cover more people. While we accept that there must be more money in the system, and FACE would like to acknowledge the effort of Congressman Abercrombie to this end, we at FACE know this is not all that healthcare reform needs. Reform also means moving our national system to a quality of care, which includes evidence-based practice, high-quality computerized medical records, and working with best practices of medicine with complete transparency of health plans. If not, the number of citizens in our state and the nation without health care insurance will increase, exacerbated by the high unemployment rate, and when they need care, they will go to the emergency room, and this will be even more costly, especially since at that time, the condition of the individual will be such that it will be catastrophic. Thank you.
Thank you, Clementina.